Welcome to the SuperPod podcast. I'm Emily Ball from Active Step Healthcare in Whiteley, and I'm thrilled to be joined by Dr. Donal Collins from a new company in Gosport called Barlow Collins. Would you like to introduce yourself, Donal?
Thank you. Thanks for having me this morning.
Pleasure.
So I'm Donal Collins. I used to be a GP in Fareham for 25 years. And myself and my business partner, Lynn Barlow, set up Barlow Collins, which started in October.
Right in the middle of the pandemic.
Right in the middle of the pandemic. And I had planned to retire in September. And myself and Lynn worked together in a ear, nose and throat clinic for the previous 17 years. And we'd always promised ourselves we'd do something different for the last few years when we retired. But the driver behind this is a story of personal failure. And I think some of the greatest learnings we have in life is from failing. And often people aren't allowed to fail often enough. And the more we fail, actually, the more we learn. And I think we actually learn a little bit less from succeeding, if that makes sense. So my personal failure was at a time of system leadership within the NHS, when I was trying to develop systems to prevent long-term conditions within populations. I myself developed a long-term, totally preventable condition.
And what was that?
A condition called type 2 diabetes. And it happened probably at the height of my career. I was exceptionally busy, still pretty much a full-time GP, involved in system transformation, involved in what was called a Vanguard trial that was going on in the area to try and change the way we work, improve access to patients and prevent disease. And here I was as one of the leaders then developing a totally preventable long-term condition, which one was embarrassing, two was I felt I had failed, and it was a moment of, oh my God, how have I got to this place?
I'm sure a lot of people could sympathise or empathise with how you felt to suffer with that condition as well.
Absolutely. So I was now experiencing the feelings most of my patients had when they came to me and I said, you've got type 2 diabetes. So that was probably failure number one. Then the next failure was, I said, okay, I now need to do something about this. So I took my traditional advice. I went to see my GP. I took medications. I was told to lose 5 kilograms of weight. So I thought, here's an opportunity. Let's bring in a program of weight loss into our surgery. I'll join the patients, and every Thursday night we queue up with a well-known national brand on a program. And I lost 5 kilograms after 3 months. It was hard work. I was hungry, but I lost 5 kilograms, and that was the magic number. If you lose 5 kilograms, your numbers should improve. So,
and you're talking about your sort of metabolic numbers.
Yeah, so particularly blood sugars and a thing called HbA1c, and HbA1c is an average blood sugar over the last 3 months. So it's technically it's glycosylated hemoglobin, which means blood sugar stuck onto hemoglobin within your red blood cell. The red blood cell lives for 3 months, hence the suggestion that don't measure it until 3 months have gone by.
Right.
So you've got a whole new set of red blood cells to measure against. So my HbA1c on my diagnosis was 68, and then 3 months later, having lost 5 kilograms and being on a drug called metformin, which is a good drug, my HbA1c came back at 68.
Exactly the same.
Exactly the same.
So pretty demotivating, I would have thought.
Yes. But I was very lucky in that I had some amazing and fantastic patients who were on their own journey. And one of them in particular was from Southeast Asia. Not your typical diabetic shape, so very thin. He had a BMI of about, I think it was about 27. But his HbA1c at diagnosis was 110.
Sure.
So really high. Normal HbA1c is up to 41. Over 48 is diabetes. 110 is really high. So we said, you need drugs. And he said, I'm an engineer. Can you let me deal with the root cause and see if I can fix this myself?
We see this a lot with our patients as well. They don't want a magic bullet. They want to be able to deal with the root cause and prevent it going forward.
So I said, sure, you do what you have to do. Come back to me in 3 months. We'll recheck your numbers. And of course, you'll still need drugs. So he came back and his HbA1c had come down to the mid-60s. I said, you've done really well. In fact, I was a bit shocked that he'd gone from 160 without any medications. And he said, well, I've only partially done what I should have done. Give me another 3 months. And when he came back, his numbers were in the 30s. So bang normal. So then that really intrigued me. So I asked him what he did. And then, so his failure number 2 was, he said to me, I didn't want to tell you because you would have said it was dangerous what I was doing. So that was actually quite hurtful to think somebody wasn't able to talk to me as their GP. So that reflected on the way I must have been coming across to them over the previous few years. But having got over that, he told me that essentially he understood that he was carbohydrate intolerant. He had removed carbohydrates from his diet and he had increased his healthy fats. And in doing so, dropped his own insulin levels and fixed his type 2 diabetes.
Wow.
And I said, well, that sounds remarkably simple, so how come we're not doing this all over the place? Because certainly the paradigm was eat less, move more.
Sure, and this is what we all hear, isn't it? So I think classically, the image that's associated with what I'd call late onset diabetes is that people have chosen poor lifestyle choices, put on weight and aren't active. So classically, they go to their GP and they're told to lose weight and do more activity. And that's what you were told. And that's what everyone else is generally told.
And that's what I was telling people.
Sure.
And there was an interesting review of the GP database from 2004 to 2014 when they looked at the advice of eat less, move more. How often is that advice successful? And the answer is you are going to fail 99.4% of the time. And we're supposed to be an evidence-based system.
Yeah.
And this is what we're chucking out all the time. And then when people come back and they haven't lost it, we then say, you haven't been trying hard enough. You haven't done what you need to cut back more. You need to cycle more. You need to run more. And it just creates that sense of failure. It's my fault. Which
ultimately is demotivating and soul-destroying.
Utterly. And I can remember at the peak of my illness, I was 17, 18 kilograms heavier than I am now. I'm still overweight, still on the journey. But I was starving all the time. I'd have a full meal, and within 20 minutes I'm hungry again. And I think people who have not got insulin resistance don't understand the driving hunger that you have that's pushing you all the time. And then, of course, when you're in a busy lifestyle, harder work, seeing loads of patients, going to lots of meetings, the food on the go is always, the Mars bars, double-decker bars, the Costa coffees with all the syrupy shots, sandwiches, bread. So
it's really hard, isn't it, to avoid those things?
Yes. So the key, what my patient taught me was fix the hunger, kill the hunger, then everything else becomes easier. And when he told me what happened to him, I looked it up. I said, is there any evidence? Is there any papers? And actually, there's loads of science, loads of published papers about this. But because we're not selling a drug, we haven't got a big multi-million-pound marketing department behind this.
You're talking about big pharma here, aren't you?
Big pharma and big food.
Right.
So, if you go into McDonald's, Kentucky Fried Chickens, whichever brands you want to pick, it's all about the calories. And in fact, what I've learned is it's not about the calories, it's about the quality of the calorie. And there's in a recent book that's come out by Dr. Lustig called Metabolical, brilliant book if you ever want to read it.
And that's metabolical.
Metabolical. What he will say is it's not about the food, it's what's been done to the food is the issue. So the more processed the food is, the more damaging it is to your body. If you eat food as close to nature as it gives it to you, the better it is going to be for you. And by doing that and increasing the fat content of your diet, which we have been told to avoid.
And culturally, for years, we've been told low fat.
It kills the hunger. Then it stops that drive to keep snacking. So amazingly, I'm now eating typically one meal a day. If you had told that to me at the beginning of my journey, I would have had several panic attacks. Because I needed my breakfast, I needed something at 11, I needed my lunch. Patients are wonderful. They'll come in and bring you biscuits, cakes, chocolates. Never bring you in a nice, bit of steak or some spinach and mushrooms cooked in butter. But because these are the things we reward ourselves with. So the reward culture is all around rapidly absorbing carbohydrates. And whenever we have a treat, whenever the kids do something really well at school, what do we give them? Nice
sweets
cakes.
Or treats or cakes. Yeah.
So when I switched, it really was it was liberating to have this hunger lifted from me, and then the ability to go through the day without eating was quite extraordinary. And then typically my breakfast is cream in my coffee. And since I started doing that, 17 kilograms have just fallen away without me really trying.
That's a huge amount.
Huge amount. So 5 rungs on my belt have disappeared. Still a lot more to go. HbA1c is now down in the 40s. So technically in remission. But, I will always be at a much higher risk of getting back into diabetes again if I let this go. So this is a lifestyle. This is me for the rest of my life. This isn't a fad. And in fact, this way of eating is actually how we ate back in the 1800s, 1700s, early 1900s. And it's only since the processed foods have started evolving.
Which probably started, post-war?
Post-war, and then, of course, the change in the dietary guidelines in the 70s was a big disaster that drove everything the wrong way.
Absolutely.
When essentially it was a politician in America made a decision on what was the right thing to eat because the scientists said we were unsure about what was the right way to go.
It's interesting because obviously COVID has been a massive pandemic for the whole world, but diabetes is equally as scary, isn't it, really? We know it costs the NHS 10% of its overall budget. So what is it that you're doing at Barlow Collins that's going to change, hopefully, the way that we do things?
So we're doing several things. So one is we'll see people individually. We see people in groups. And then we do some population health management remotely via an IT platform. And that's really exciting. So in Havant, we're working with 40 people via a platform remotely, so nobody meets them face to face. And the first set of results have come in after 4 months. Now, this is a group who are on injectables. They're on a thing called GLP-1 agonists.
And these are diabetes drugs?
Yeah.
So they all have type 2 diabetes?
All have type 2 diabetes, and also all are uncontrolled. So their average HbA1cs were in the high 70s.
Right.
Most of them are on 2 injections, insulin and another one, and on a multitude of oral drugs as well. So when we started the program, essentially the GP said, would you like to do something to improve your diabetes, get you off some of the drugs and potentially get you into remission? So 40 of them put their hands up. And we've had a 24% drop in their HbA1c. Their lipid profile has improved dramatically. Blood pressure has come down, and a dramatic reduction in drugs.
Wow.
And then the individual stories are more powerful than the sort of data sheet. So we had one chap who had leg ulcers for the previous 2 years. He had 16 appointments in the last year to get his legs dressed. And he came back when we really weighed him and we measured him. He said, oh, by the way, my ulcers are gone. So coincidence or causation, you can argue whichever. But now he's not getting the cost of the bandages. 16 appointments have been freed up in the coming year. And he was also attending secondary care because it was a complicated ulcer.
Sure.
We've had a number of people improve their sleep apnea. They've stopped snoring. They've stopped using their CPAP machines.
Right.
nearly everyone's saying, I'm sleeping better, my energy levels are better, I'm enjoying life, I'm able to do things. A lot of the overweight people will, one of the easy tests we have is how easy is it to tie your shoelaces? If your belly gets in the way, it's hard to tie your shoelaces.
I love that. Very non-clinical test. Speaks volumes.
And, a lot of people can now easily tie their shoelaces. And this is a group who people would have said, you guys can't do this. This is you for the rest of your life taking these drugs. So it's a real message of hope. And it's just been, I come in here and it's a bundle of joy coming in here. I look forward to it. My last job, while it was a great job, and I also loved it, it was really hard. And did I love coming into work every day? Probably not. But every day here we do change people's lives in a measurable way.
Well, you've changed my life, and we'll come on to that in a minute. First of all, tell us how many people are doing this. How many people are doing what you're doing in this country at the moment?
So if you went back 5-10 years ago, there would have been a few nutters, a few zealots, they would have been called. The paradigm was very unkind to them. One of them being a great guy up in Southport called David Unwin, and you'll now see him quite often on the national press. But there's a group who are on Telegram. We've got a group on that, and there's about 230 people active on that now. So there's 230 health practitioners telling people to don't eat sugar, don't eat processed foods, eat whole foods as nature gives it to you, with amazing results across the country.
Which is encouraging, but we're still talking about hundreds rather than thousands when you think about the number of GPs there are in the country.
Yeah, so it's a social movement. It's moving and growing. We're collecting evidence, we're collecting data, and we're demonstrating that this is a truly sustainable health-creating salutogenesis, whatever you want to call it, as opposed to managing a disease and walking with the patient as they get worse. So I think it's the first time in my career where suddenly you can see health actually improving and creating rather than managing a condition.
So a lot of people watching this are going to be wondering, gosh, my parents had type 2 diabetes. Is this something that I need to be concerned about? First of all, what would be the symptoms of what we term metabolic syndrome, which is the precursor to developing type 2 diabetes?
Absolutely. So type 2 diabetes is the end of a spectrum. And I think, when people are beginning to get metabolically unwell, one of the first things that'll happen is your middle get a bit bigger. So big belly, blood pressure might rise. Right, you may get abnormal blood sugars, and then when you see your GP, if you get your lipids checked, there's two particular lipids you need to look for. One is called triglycerides, and they'll typically go up. That's a bad sign. And HDL, which is called the good cholesterol, will go down.
Right.
All right. And when you look at the definition of metabolic syndrome, what's interesting is what's not in there is total cholesterol, and what's not in there is LDL. Okay, so within the definition of metabolic syndrome. And I think we were beginning to understand that previously LDL and total cholesterol was viewed as a bad thing, but the evidence is really strongly questioning that now.
Interesting.
Because the LDL is a family of subtypes, and within it you have atherogenic bad stuff, and that's the small dense LDLs, the ApoBs, that do cause damage. Do cause heart disease, does cause strokes, does cause leg ulcers and vascular disease in your legs, neuropathy and all those things. But if you change the way that you eat, you can dramatically flip that on its head.
Sure.
And as you and I know, the weight just falls off, you feel better, and your numbers improve.
Sure. And I think you mentioned to me as well that things like family history of heart disease, family history of course, diabetes, also the development of things like skin tags as well is also a sign. So,
yeah, because typically with metabolic syndrome, you're going to get it's called insulin resistance, and to have insulin resistance, you must have a high level of insulin within your body. And insulin is a growth factor; it makes things get bigger. All right, so belly gets bigger, And typically for people, they might notice skin tags, particularly in the armpits, will appear sometimes in the groin as well. And what's interesting is if you fix it, these seem to shrink and go away.
Seem to go. And how many people do you estimate in their maybe 50s and 60s would have metabolic syndrome?
So there was a paper from the States. Now the States is always a few years ahead of us in terms of progression of disease and being bad, where they looked at the adult population in the States to say how many of the population do not have at least one of those 5 arms we talked about. So big belly, blood pressure, abnormal blood sugars, not necessarily in the diabetic level, but just above, or raised triglycerides or low HDL. And it was only 12% of the population did not have any of those.
Wow, so this is a huge problem, isn't it?
Yeah, so they're at about 88% unwell adult population. My finger in the guess is we're probably around 82, 83.
Wow. Now, I came to you because I've been following your work since you opened Barlow Collins. Now, just a bit about me. So I've had diabetic pregnancies. I'm 39 years old, and I've been struggling to lose this band of fat around my middle. I've been suffering with low energy, a degree of hair loss as well. And I was getting very frustrated. I've been seeing a nutritionist, she's been helping tremendously, but we kind of got to the conclusion that I was carb intolerant, a bit like what your chap said. So I came for testing myself, and what were the results?
Well, so what's interesting is the test we do is with an innovative organisation from Holland. It's a point-of-care capillary test, so a bit like when you check your blood sugar, but a bigger lance and a bigger bit of blood.
Still finger prick testing.
And then we measure your baseline. So we measured your fasting glucose through a glucometer and a fasting insulin level.
So I basically had to go to bed, not eat anything, and then come in and drink a horrible glucose drink. And then every half an hour you tested my bloods.
Yeah. And then essentially you're going to get your, see what happens in your body in response to a carbohydrate load. And we demonstrated with you that your peak, as far as I remember, was at 2 hours. So your insulin went higher than it should and stayed higher for a lot longer than it should have. So if you think about that during the day, is when you're having your breakfast, you might, I don't know if you're having your 11s, something at 1 at 3, 5, your insulin is constantly high all day long.
Yeah.
So you're permanently in fat storage mode.
Which makes perfect sense.
You're always getting ready for hibernation.
Yes.
So your fat cells are growing and getting bigger.
I'd be great in a famine, I think he said to me.
Yes, you would survive. But we don't get many of those these days.
No,
thankfully.
this is the problem.
And so then your ability to lose weight, it's almost impossible to lose weight.
I think you characterised it by saying, unless I put my body into starvation, i.e. less than 1,200 calories a day and exercising maybe 5 times a week, I would struggle to lose weight, which for me was mind-blowing because I had been on a low-calorie diet for several months. I had been exercising and feeling very frustrated and denying myself any kind of treats at all because I just felt that if I did that then I'd be compromising my own health. So this was mind-blowing for me because it kind of demonstrated that metabolically it wasn't because I was not doing enough and it wasn't because I was eating all the wrong things, because actually I think you said my food log on the face of it looked pretty healthy, but you identified things like porridge, mango, things like that, which you would think were very, very healthy things to eat, as actually being quite counterproductive for me.
And again, so if you're well and you're metabolically well, eating whole foods like those would be okay. But when you're unwell, if you're trying to fix yourself, then they cause problems. So I don't know if the camera can see this. But this is a normal curve on actually a gentleman down the corridor who's in his early 30s. Very thin, very fit. He cycles a couple 100 miles a week. And what you can see here is fasting blood sugar and insulin start off nice and normal. He has a sugary drink here, quickly spikes, and then comes back down again.
So mine spiked almost double that, didn't it?
Yes.
Yeah.
And And then it doesn't really get above 30, so it doesn't go terribly high, but it's a quick up and down.
Yeah, the key thing here is that it comes down within a couple of hours, whereas with mine, it doubled, and actually my blood sugars didn't normalise for about 4.5 hours.
Correct.
And I think one of the messages that we want to get across today is that there are a lot of people that are experiencing these things, but if they actually went to their GP, this wouldn't necessarily be discovered, certainly at my stage in life, because they don't test for insulin, do they?
But that's not their fault. If they send send a test off to the lab will not do it unless the lab, if you say to the lab, I believe this person has a pancreatic tumour that's producing insulin.
So it's within the guidelines. They're working within their guidelines.
Absolutely. So the sad thing is I needed to come out of the NHS to be able to do this.
Wow. And what does this one show?
So this shows insulin resistance. So what you can see, the units are different now over here. So what happens with this person, the pink dot represents the sugary drink. Insulin rises, but you can see here we're now up to nearly 90. All right, so a lot higher.
Whereas this chap was like 20.
In the 25. And then it stays 4 hours later in the 20s, okay, having started at a fasting level of about 4 or 5.
Yeah.
So this is an insulin-resistant abnormal response. And then you can see here, so this is 10 o'clock, has a peak at 11, and has only come down from the peak at 12. And so we're going to have our breakfast here, we're going to have our lunch here.
And you're just going to keep getting these...
So you can see you're always living in this green peak.
Which is fat storing zone, which then leads on to other health issues, as we've discussed.
So high insulin levels, you retain fluid, you retain sodium, blood pressure rises, you put on weight, your fat cells get bigger. There's two types of growth of fat. There's hyperplasia and hypertrophy. So hypertrophy is where the fat cells get bigger and bigger and bigger, and eventually they sort of nearly outgrow the blood supply. So then that's when they release the inflammatory markers. And that's the stuff that causes the damage. Whereas some people can be overweight and healthy. So there are some people whose fat cells just keep on dividing, and you get loads of tiny little fat cells. And so they're the people who, may be overweight, they never get high blood sugar, never get abnormal lipids, and never have vascular disease. They may have sore feet, they may have sore knees. And typically they're the people that you'll see who, they'll have small bellies, they may have big bums and big thighs. But it's all about the visceral fat. The visceral fat is the one that really causes the damage.
The one we're worried about. So what did you suggest for this particular person? I mean, I know what you suggested for me, but what was the treatment you suggested for this person here?
So this person here, again, was eating what most of us would have done. So, healthy cereal in the morning. I say that
sandwich for lunch.
Yeah. Brown bread, whole grain. And, some whole grain biscuits at lunchtime and, and
maybe
so
meat and potatoes for dinner.
Potatoes, rice is a popular one. And these are all laden in carbohydrates, which then get broken down to glucose, and that drives your insulin to go up. So what we're trying to do is keep your insulin as low as you can, and by accident you will lose weight.
Yeah.
You'll start sleeping well, and you'll start feeling better.
Well, this is what I'm finding.
That's really good to hear.
Yeah.
So tell me about you. Tell me about...
Sure. So I've adopted exactly what you just said. I've gone low carb, high fats, and already within 3 weeks, I don't feel the need to eat 3 meals a day, which is interesting because I used to religiously have my breakfast, lunch and dinner and a few snacks in between. I'm not finding it hard. My sleep is better. I have more energy. You mentioned about energy being an issue for people that have got sort of metabolic syndromes, etc. And I've lost probably just over half a stone in 3 weeks, directly down my middle. Possibly a lot of that is water, but certainly some of that's going to be fat because I believe that I'm now in that fat burning zone, which you call ketosis, which is kind of a very different way of burning energy, isn't it, to what most people do with carbohydrates.
Yeah, and some people are afraid of that word. So all ketosis means is you've moved from using glucose as an energy to ketones. And then when you move to burning ketones as an energy, what happens is you also breathe them out and you urinate them out. And And so that is always a way of so you're constantly getting rid of energy. So it's actually an inefficient way of burning energy. So it means when you're asleep, you're also losing weight and losing energy.
Yeah.
Whereas when you're burning glucose, you're conserving energy.
Wow.
In a big way.
We've covered a lot of ground today, and it's been absolutely fascinating talking to you again. What message would you like to leave with our viewers today?
If you want to improve your health, eat whole foods, natural ingredients, as close to as nature has given them to you. So if you're not metabolically unwell and you have fruits at home, eat them whole. Don't juice them, because then that takes the fibre out, and it makes you rapidly absorb the glucose to get that big insulin spike. Avoid processed foods. So how do I know if a food is processed? If it comes in a plastic wrapping with probably more than 3 ingredients, it's processed. If you're a meat eater, if you're getting meat from the butchers as we would recognise it, that's going to be okay. Particularly grass-fed is better than soya-fed. So soya is another issue we could spend an hour on. That's a disaster for the planet, animals and humans. And then eat when you're hungry, eat till you're full and stop. And don't snack.
Excellent.
And then enjoy your food and enjoy your life.
Really important. And how can people get in touch with you if they want to find out more about what you're doing?
So we're based here in Ferrum Innovation Centre. We've got a website, www.barlowcollins, BARLOWCOLLINS.co.uk.
Excellent. Well, thanks so much for joining me today, and I hope to see you soon.
Thank you. Really enjoyed it.